Welcome to Public Health Matters, where we talk about matters of public health. This month is National Immunization Month, and we have with us today Tricia Glastetter, our immunization coordinator from the Division of Public Health and Community Services. And Tricia is going to talk about the importance of school-based vaccination clinics, as well as the vaccination schedule for our children and the services that we provide at the division through our immunization program. Tricia, welcome.
Thank you, Bobbie. It's nice to be here.
So glad that you could join us today. So Tricia, first tell us a little bit about your role as a public health nurse and what you do as an immunization coordinator.
Sure. So our biggest, I think most important role is to make sure our community is protected with preventative care, such as immunizations. Right now, we're very school immunization focused because school starts next week in NASHUA. So we are working hard to make sure our children are immunized for school.
So let's talk about what that looks like. And so there are some required vaccinations that the children need to have. And depending on the grades that they're going into, there are specific vaccinations that each grade level, whether it's going first year in school or going into middle school or going into high school.
Sure.
So let's talk a little bit about the vaccines that are required at those different stages.
Sure. So in the state of New Hampshire, there's actually requirements from basically 2 months old all the way through high school, and colleges also have requirements. So our child care centers have requirements starting again, like I said, at 2 months old for their what we call a DTaP, their diphtheria, tetanus, and pertussis vaccine. Hib, that's, I'll always mispronounce this one, Haemophilus influenza B, I think type B. Their polio vaccines. It's when people always, they think polio doesn't exist anymore. It's so important. So DTaP, polio, Hib, hepatitis B. Typically, children get a hepatitis B at birth, but there's some reasons that they don't get a hepatitis B at birth. And I know I'm forgetting one. DTaP, polio, Hib, hepatitis B. No, I think that's it at that age.
Right.
Not till they're about 1 year old, they get their measles, mumps, rubella, and varicella. But throughout infancy, they get 2 months, 4 months, 6 months, and so on, they get their vaccines. And then before kindergarten, they usually get a second dose of their MMR and their varicella, and maybe a catch-up for their DTaP, polio. They want to have one of those after the age of 4. In school, they don't usually get another vaccine until about 11 years old. Sometime.
So that's a nice little gap and
it's a
break
big
in
gap.
there. Yes.
Of course, we want to make sure they're getting their flu vaccine seasonally, and COVID if that applies based on their age. But flu vaccine is a seasonal vaccine. We want to see that around the end of September, October. We're coming up on flu season pretty quick. But around 11 years old, so that's usually about sixth grade, somewhere right around there. They need that tetanus vaccine again. So that's called the Tdap, tetanus, diphtheria, and pertussis. So we see a lot of kids catching up for that right now because they can't go to school, or they can go to school conditionally enrolled, as long as they have an appointment to get that vaccine.
And the school nurses, usually about, when do they start sending the letters out? Because then we will get the parents coming in or the guardian bringing the kids in with a letter from the school, and it'll have on there what the kids need for coming into school.
It does. So in NASHUA, I know it varies town to town. So thankfully, New Hampshire's a universal state, and children can go anywhere to get their vaccines regardless of insurance status too. I did want to make sure I mentioned that. And regardless of ability to pay, they can get their vaccines. But in NASHUA, our school nurses typically go through those records before the end of the school year, the prior school year.
Okay.
And parents often get a letter saying, hey, you know, your child's going to need that Tdap before they go to 6th grade, or, you know, if they're 11 or 12, depending on their age. But now is also the time that our school nurses are looking at it and saying, oh, you didn't get that, you need to, turn in the paperwork or get the
Right,
vaccine. So we're getting a lot of phone calls right now, either from parents, new enrollments, or from the school nurses.
Right.
Yeah.
And it's good that here in the city of Nashua that we have our public health department and school department collaborating together.
Very much
so that the kids won't have to miss any days. So they can start conditionally, but if they don't get that vaccine by the date that's on that letter, then they'll ask them to be excused from school until they get vaccinated.
Yes, so they can be enrolled conditionally as long as they have a dose of the required vaccine on board.
Okay.
So if they have no records at all, which we do see occasionally, if they have no records at all, they need to get a dose of each required vaccine prior to being able to go to school.
Oh, okay. So just for clarification, the condition would be if they had a dose on already.
Correct.
If they don't, then they won't be able to go into school.
Correct.
They won't be able to start.
That our Nashua school nurses are really good about making sure that each child has what they need, but there's a lot of kids, so it can get overlooked. So we are supporting them that way as well, helping to go through some records.
Okay. Yeah. And then what about for college? Because there is a vaccine that's recommended for...
There's a couple of vaccines recommended for our college kids. And each college is a little bit different on their requirements. The ones that we do ask, or we do recommend when they come in, even though the school might not be requiring it, meningitis. So there's
That's so important.
So important if you're living in a dorm, any dorm, because you're living close together with each other. You might be sharing drinks or utensils, and meningitis is so dangerous. It can be deadly, but you can also lose limbs, lose your hearing. So meningitis vaccine, we typically do one around 11 years old. It's not school required, it is when we recommend 16 years old. But if they have none on board, we definitely want to get it if they're going off to college.
Definitely.
Meningitis, it's called meningitis ACWY and meningitis B. There's two different vaccines that we want to make sure they have.
Okay. Now, there are also some other vaccines that we also want some of our kiddos to take as well. And so
we've
we've got
optional ones?
Yes.
Sure. So again, around 11, when they come in for that Tdap, not only are we recommending a meningitis vaccine, the meningitis ACWY, but HPV, the human papillomavirus. We do have a very frank discussion, a very open discussion if parents allow us to have that and discuss what HPV is or what human papillomavirus is. And I'm very passionate about it. I think it's super important. We don't have vaccines that prevent cancer.
And this is one of them.
This is one of them that prevents cancer. I mean, to me, that's incredible. So we do have that open discussion, and thankfully we do have a lot of parents that are like, yes, please.
Yes.
So with the younger, sorry, go ahead.
I was going to say, and it's important to get it, when they're younger because of
prior
possible
to exposure.
Yes,
exactly.
Exactly, right? Because we have seen an increase in oral cancers as a result of HPV virus, right? And so if we can get our young people vaccinated earlier at the required 11, 12, and you can get it up to a certain age, right? Because
so
they've actually extended, right?
They increased it. Once upon a time, it was for it was more geared to its younger girls, and then it was extended to include boys because boys, we know that it can cause cancer for the boys as well, and they can pass HPV on to a partner, male or female. But then they extended the vaccination age recommendations up to the age of about 26.
Right.
Well, more recently, I think within the last 2 years or so, they extended it up to the age of 45 under clinical discretion. So that's something you need to talk to your provider about. If it is something they're interested, they can also talk to us about it because it's a case by case between that ages of 26 and 45, whether or not they can receive the vaccine.
And now, are we offering the HPV up until that age as well?
We do. We do have the ability to offer it. So as you know, 18 years old and under, they can come to our clinic with an appointment. regardless of their insurance status. It does not matter if they have insurance when they're a child in New Hampshire. They can come see us based on our vaccine supply. For our adults, it's a little bit different. For our 19-year-old and up, we do service uninsured and underinsured adults.
Okay. Now, is there a fee if you come to the immunization clinic?
There is a fee. It's a $10 flat fee regardless of how many vaccines you're receiving. So you could be getting 1 vaccine or 5 vaccines. It's $10. If you have the inability to pay that $10, we waive the fee.
All right. Because again, we want to make sure.
We want to make sure. So you need to remember that your vaccine is also protecting me.
Right.
It's protecting my children, grandchildren, you know, everybody around us. I'm not only protecting myself, but I'm protecting my community as well.
Yeah. And that's awesome. So, and we know that vaccines have been one of the most successful public health interventions in prolonging life and preventing disease.
Right.
Now, you mentioned some adult vaccines when you started to talk about
Yes.
the age of extension for HPV.
Yes.
What are some other, because it's National Immunization Month.
Yes, yes.
So what are some other vaccines that we want adults to also be aware of and to stay on top of?
Sure. So generally, again, flu season is coming up, so we want our adults to get their flu vaccine as well.
We want
Yes,
adults
please.
and children, everyone that's
Yes.
age eligible to get that.
6 months old and up, you
Yes.
can get a flu vaccine.
Yes.
So that's, of course, important. COVID, if you have not had your COVID vaccine, we know that's a changing, recommendation on that is changing. We probably will have more information in the fall on the COVID vaccines. But for all adults, depending on what they had as a child, we can review records and say, oh, maybe you missed a hepatitis B vaccine because it's a series. And we can provide that hepatitis B catch-up even for our adults. But a Tdap, that one we mentioned for our 11-year-old, that's a shot you want to receive every 10 years. And every pregnancy for our pregnant women. They get a Tdap every single pregnancy. Even if you have a pregnancy every 9 months, you still receive a Tdap every pregnancy, because when that baby is born, they cannot be vaccinated for that. And Tdap, the P is pertussis, which is whooping cough, which can be deadly for our little ones and our older folks.
Right. And then Tdap, isn't that also recommended for grandparents?
It is recommended for,
Child
good
care providers
question, Bobbie. I
and
love
for
that
dads.
question. Yes. Anybody that is going to be around that newborn should be vaccinated. Again, if you haven't had one within that 10 years, you want to get up to date on that Tdap. So grandparents, parents, caretakers, anybody that is going to be around the newborn that can't protect themselves.
And we have seen, again, cases of whooping cough or pertussis, and again, this is vaccine preventable.
Absolutely,
Yeah.
yes.
So with the, you talked about the COVID, and so we are still, even though we're out of the emergent response to COVID, right? So lots of people have been vaccinated, and so that gives them some protection and coverage, like you mentioned, for themselves and for others around them. And then they've had the boosters, and now we are, just like with the flu, looking at an annual vaccination for COVID, which is going to be the monovalent that's coming out. And that's important because right now, we're in the month of August, getting ready to get into the fall. The expectation is that we're going to have a little bit of an uptick in COVID, just like we're expecting for flu as well. And so we definitely want to encourage our community members, family members to go ahead and get that monovalent vaccine when that's available. How will that be offered at the public health clinic?
So it's not completely known at this point exactly because the emergency orders changed, or they ended, I should say.
Yes.
So the vaccine was provided federally, and now it's a little bit different. They are working on a bridge program, so our children will be covered under our Vaccines for Children program. Again, universal state, thankfully. For our adults that are uninsured, there's going to be a bridge program to help cover, say your insurance doesn't cover it, or there's financial concerns or anything like that. So we don't completely know the answer to that.
But stay tuned because we will get the answer.
Yes, we should have the answer, hopefully, the end of September, maybe. Yeah. Yes.
And we'll make sure that we put that information out because we want we want our communities to be informed and be able to take advantage of getting the vaccine when they need it.
Yes. There's other ones I'd like to mention because we think about COVID and flu right now especially, but pneumococcal vaccine. Right now, the recommendation is for 65 years old and up if you haven't received a pneumococcal vaccine to get the Prevnar 20. If you have received a pneumococcal vaccine in the past, we would want to look at your records to see what vaccine you should have. And of course, our children get pneumococcal vaccines as well. But then there's a big gap when you're not receiving one. And there are some ages, or some people between the ages of 19 and 64 that also should receive the pneumococcal vaccine based on their risk factors.
So, and what would those risk factors include? So would that include, I know smoking is one of the risk factors.
It is. So smoking, heavy alcohol use, asthma, COPD, diabetes. Those are just some of the risk factors for that 19 to 64-year-old population that should receive a pneumococcal vaccine.
All right, and that's also very good to know because we also, last year we saw some pneumonia cases, right? And so
we have seen one, I can speak, one we've just seen very recently of invasive pneumonia. Yes.
So again, vaccine preventable.
Very important.
And then there's the new RSV that's coming out.
Yes. So the vaccine, the one geared to its children, because we've heard about two different and I say vaccines in quotes because the one for children is technically not a vaccine.
So what is it technically?
It's called a MAB, a monoclonal antibody.
Okay.
So it works a little bit differently than a vaccine works. So a vaccine makes our body create an antibody, typically. This is an actual antibody, or yes, a monoclonal antibody. There is again, we don't have all of the information yet. It's approved. And I can tell you that an RSV vaccine has been around a long time because my son, who turns 24 today, received it when he was a newborn. So the guidelines have always been children that are at risk during RSV season, so preemies, babies born a little too early, or that have certain risk factors would receive this through RSV season. But now we have an adult that's a true vaccine, an adult vaccine. We don't have it in stock yet, and there's going to be some limitations on that as well. But
as far as who,
based on
prioritizing?
Yeah, based on funding and based on supply.
Yeah, and it actually is going to be important because last year we saw an increase in RSV, I'm not going to be able to say it, syncytial virus.
Yes.
Respiratory syncytial virus.
Yes,
there we go.
Exactly.
But we did see an increase in the number of cases, and we typically would see that in children.
Yes.
But last year we saw it in all ages, and particularly in the elderly.
So some of that increase was due to our testing. So people were being tested for COVID, but on that COVID test, we also it was a test that tested for COVID and flu and RSV, and sometimes I think.
Did it test for pneumonia?
No. Okay. I think there was something else on there, if I recall correctly. So there was a lot of increased testing for RSV. So they caught it. Might not necessarily have been affecting the person, because they might have had COVID as well. So we don't know exactly what was causing all the symptoms. But it's a pretty scary thing if you've seen a little one with RSV, somebody very young, like a 6-month-old, or a 80-year-old with it. It's pretty scary to see.
Yeah, and I know that there were quite a few folks, adults that had it, and it was scary for them as well. Right, because you're not getting that diagnosis of flu, you're not getting a diagnosis of COVID, and yet you're very ill. Right. And that's what it turned out to be.
If you don't have the answer of what it is and know what care you should be receiving.
Yes. Yeah. Now there's one more vaccine that we have to talk about for adults. And you remember when I got mine?
Oh, the lovely
The lovely
shingles vaccine.
Yes.
I
And let's
remember.
talk about what not to get when you go to get your
Well,
shingles vaccine.
well,
Not at the same time.
that's personal preference, but so yes, the shingles vaccine. If anybody you know has ever had shingles, it's painful,
It is
and it can
painful.
have long-term side effects. It hits the nerves in certain parts of your body, and again, if you've ever had any kind of nerve damage or nerve injury, it's extremely painful. So the shingles vaccine, currently the recommendation is 50 years old and up. You receive 2 shots. There are some people that might be a little bit older that have already received a shingles vaccine in the past. That's an older vaccine that we no longer use. If they receive that, they should still get what's called the Shingrix vaccine.
Okay.
They stopped making the other one, the Zostavax. I think around 2018 we stopped offering it.
Okay.
But yeah, so there are some side effects, as you mentioned.
Oh, yes, I've lived through those side effects.
But that means your body is fighting and creating those antibodies to fight shingles.
Right.
So yeah, side effects of the shingles vaccine is similar to a lot of other side effects, vaccine side effects. So the sore arm is the biggest complaint. And I say sore arm, it's almost like sometimes it's hard to lift your arm
Right.
after you get that vaccine.
Very similar to the tetanus.
Yes.
The Tdap doesn't have that same type of...
I always tell our kids, or I often ask our kids, hey, do you have any siblings? Have you ever been punched in the arm by one of your
Yeah,
siblings? That's kind of how the Tdap feels the next day, like somebody
Right.
gave you a knock in the arm.
Right.
But the shingles vaccine can be a little
bit
more body aches,
Right.
a slight fever, chills, fatigue.
Oh, the fatigue.
Fatigue,
Yes.
yes. A general unwell feeling.
Right.
And that, again, is a 2-shot series. So we warn people.
But then you get that protection, right?
You
So
do.
that 2 days of feeling a little bit uncomfortable, especially with shingles,
Right.
is something that your body can deal with other than getting the actual disease itself. And some people have gotten shingles more than once.
We just had somebody in the clinic that spoke about that. They were coming in for their shingles vaccine. They'd had shingles twice
Yes.
over. So the shingles virus is a herpes virus like chickenpox. So if you've had chickenpox as a child, you have that virus in your
dormant,
body.
right?
It's just
dormant.
sitting there.
Yeah, just waiting for...
just waiting for something to
A
basically
stressor.
awaken it.
Right, a stressor.
Yes, to
Yeah.
awaken it, and it can wreak havoc on your body.
And it does. They
Pain,
get a
painful,
rash, right?
painful rash, itchy. It can, again, have long-term effects. And that pain, you could have no rash, but still severe pain. It's
Yeah.
typically on one side of
On
your
one side,
body.
yeah.
Yeah.
Along that dorsal nerve
Yeah, it's
ganglia.
on your, yeah.
And it is. It can
Yeah.
be quite painful and can
Yeah.
actually affect your vision
Your
as
eyes,
well,
yes,
right?
yes.
Yeah. So
Yep.
that's why it's important. So we've talked about our childhood vaccinations. We've talked about vaccines that are adolescents and even adult vaccines.
So the adult vaccines, it's almost the same recommendations for our kids. The only big difference for our adults, aside from the ones we mentioned very specific for our adults like shingles, is we don't do polio vaccines for adults in the United States. That we typically stop vaccinating, well, they're usually vaccinated by the time they're 5,
Right,
fully
right.
vaccinated for polio. But if they're not, we want to get them caught up. But we typically stop administering polio vaccine at about 18 years old if they need catch-up. Because we don't see, and I'm superstitious, sorry, we don't see polio in the United States. There's different types of polio. So other countries have different types than we have.
Right, yeah. So we don't see active disease, but we may have individuals that have had polio that you might see that
Yes.
the effect of the
Yes.
polio on their bodies.
Yes.
And that has been something worldwide, that there's been huge efforts to eradicate
I can tell you that,
polio.
yes. So my mother was a polio pioneer.
Oh,
yay!
Yay!
Yeah, so she was one of the first children. I don't want to date myself, but in about not me, she received it in 1955. She received the polio vaccine. So think about how long these vaccines have been around. And yes, they've changed and improved. And that's why we don't see polio, active polio here in the United States. It is endemic in other countries.
It is.
So we want to be sure if anybody's coming here that they're protected and they're protecting the people they expose themselves to. So, yes.
So you've heard our conversation about vaccines and vaccine preventable illnesses from our public health nurse, Tricia Glastetter. Tricia is our immunization coordinator. She works very closely with our Department of Health and Human Services and the immunization program at the state level as well. We have had a vaccine registry, so let's talk a little bit about that as well, and the importance of opting in to have the vaccine records on file, because what happens? We get families, they move from one place to another, or they move from one school to another, and we would like to be able to keep track of those records. So Tricia, can you talk a little bit about why it's important to opt into having the information in the vaccine registry?
Of course. So I know, like many parents, you're busy. You take a piece of paper, you put it down, and it's gone. The New Hampshire Immunization Information System is an electronic system. It is secure. It is private. Only providers have access to the information, and the patient or patient's guardian, parent or guardian, can get access to the information. It's also a way for any vaccine provider to look at a record to say, oh, they really don't need this vaccine, they already have it. And again, the parent can access the record. If they move out of state, they can print off a copy of that record to provide it to the next school or the next state health department or the next doctor's office.
Yeah, and that's so important, because then you don't have to restart a vaccine series, because if there's no record, unfortunately, that's what's required for the schools.
If you didn't document, you didn't do.
Right.
Yes.
So, Tricia, I want to thank you so much for joining us this afternoon on the Public Health Hour for Public Health Matters, because the things that we talk about matter to the health of the public.
They do.
Now, can you just, as we end, please let folks know how they can make an appointment at the immunization clinic during our times that we have our clinic at the health department.
So we hold immunization clinics on Tuesday evenings from 4 p.m. to 7 p.m. and on Friday mornings 9 a.m. to noon. We do try to accommodate hours. If that doesn't work for somebody, we do try to accommodate. Our phone number is 603-589-4500, option 2. We do ask for immunization records. If you're coming in for the very first time, we do ask for you to bring your records in ahead of time so we can review and see what is needed.
All right, thank you.
And
hopefully we've got parents that will take advantage of the public health immunization clinic at 18 Mulberry Street. And if you can get into your pediatrician's office or your doctor's office to get those vaccinations taken care of, please do so. If not, we look forward to seeing you at 18 Mulberry Street. And you'll meet Tricia Glastetter and some of our other public health nurses.
We have great nurses.
Yes. Thank you.
Thank you.